Good morning and welcome back to my channel. I am Dr. Amita Mali. Today I am going to tell about the important homeopathic remedy that is causticum. It is very useful in the day-to-day practice, and at the end there are some important clinical tips, clinical presentation of the causticum medicine in the patient, and also there are some important Kent rubrics in which the causticum is the remedy. So let's start with the causticum today. Causticum is a deep acting medicine and it acts very well in constitutions of adapted to person with dark hairs and rigid fibers, weakly psoriatic with excessively yellow shallow complexion, subjected to respiratory and urinary tract infections. Children with dark hairs and eyes, delicate sensitive skin prone to intertigo. Intertigo means folds of the skin, dermatitis. That is diaper rash. Dermatitis at the folds of the skin. During dentition or convulsion with eruption of the teeth. During the dentition period, there eruption of the teeth, there is convulsion in the children. Generals, we will see generals now. Disturb functional activity of the brain and spinal cord from exhausting disease or severe mental shock resulting into paralysis. Causticum ailments are from long lasting grief and sorrow, from loss of sleep, night watching, from sudden emotions like fear, fright, joy, from anger or vexation, from suppressed eruption. Children are slow in learning to walk and talk, unsteady walking, and easy falling of the little children's. Now we will see mind of causticum. In mind, we will see that these patients are melancholic mood, sad, hopeless from the care, grief, sorrow with weeping. The least thing makes the child cry. Intense sympathy for the sufferings of the others. This is very important, which is seen in the causticum, that they have sympathy for others' suffering. The child does not want to go to bed alone. Thinking of the complaint aggravates the symptoms, especially hemorrhoids. Hemorrhoids are aggravated by thinking of it. There is stammering only when nervous and excited. This is very important and clinically seen in the practice that while narrating the complaints, the patient starts stammering. Otherwise, the patient is not stammering. This is only seen in the causticum patients. Now we will study for the constipation in the causticum patient. Constipation, there is frequent ineffectual desire for stool. Stool passes better when person is standing, impending by hemorrhoids. Stools are very hard, tough, covered with mucus, shines like a grease. Small shaped, expelled with much straining. This is very important in the causticum patient. The stools are greased and shiny. Pertussis, partial paralysis of the rectum, rectum sore and burns, fistula and large piles. Now we will see the urine in causticum patient. Involuntary when coughing and sneezing, expelled very slowly and sometimes retained. Involuntary urination during the first sleep at night. Involuntary urine from slight excitement, retention of urine after surgical operations. Loss of sensitivity on passing urine. Now we will see the female complaint of causticum. There is uterine inertia during labor. Menses ceases at the night, flow only during day. Leukorrhea at night with great weakness. Menses delayed or late. In the female which undergoes bladder problem after delivery or any kind of lumbar surgery, labor, forceps, causticum is indicated when there is retention after these operations. That female will show the problems like retention of urine or burning of urine, that is dysuria, after this operation. Causticum is very well used in this kind of females and it gives very beautiful results. Now we will see the respiratory complaints of the causticum. Hoarseness with pain in the chest, aphonia, larynx is sore, cough with raw soreness of the chest, expectoration scanty but must be swallowed. Cough with pain in the hip, especially left, worse when the evening. This is very unique feature which is found on the causticum only. There is during cough there is pain in the hip. Better by drinking cold water, worse by warmth of the bed. All the complaints, especially respiratory complaints, are worst by the warmth of the bed. Sore streak down the trachea. The pain with palpitation in the chest, cannot lie down at night. Difficulty of voice of the singers and public speakers. Now we will see the ear complaints of the causticum patient. Voice re-echoes, own voice roars in the ear. Right-sided trigus is very sensitive to touch. This is very unique and found only in the causticum. The right trigus of the right ear is very sensitive to touch. Paralysis of single part, vocal organs, tongue, eyelids, face, extremities, bladder, generally of the right side from exposure to cold wind or draft. After typhoid, typhus or diphtheria gradually appearing. Drooping of upper eyelids cannot keep them open. Now we will see the rheumatic affection of the causticum. Rheumatic affection with contraction of the flexor and stiffness of the joint, tension and shortening of the muscles. Skin complaint of the causticum. In causticum, there are warts which are large, jagged, often pedunculated, bleeding easily, exuding moistures, small all over the body, especially on the eyelids, on the face, on the nose. Old burns that do not get well, an ill effect from burns, pain of burns. Cicatrix freshen ups. Old injury reopens. Skin prone to intertigo during dentition. Now, sleep of causticum. Causticum patient is very drowsy, can hardly keep awake. Nocturnal sleeplessness with dry heat. Inquietable, that is restlessness. Now we will see the aggravation of the causticum patient is in clear fine weather, coming from air into the warm room, cold air, especially draft of cold air, on becoming cold after getting wet or bathing. Now amelioration is from in damp weather, warm air and heat of the bed. Some important clinical pictures of causticum which we find in the practice. We will see the tongue. Tongue is very unique of the causticum. The sides of the tongue is white and the center is red streak. This is found only in the causticum. Usually the sides are clear, but in causticum we will see the sides are white and there is red streak in the center of the tongue. Now next is in the ear we see tragus. Tragus is very sensitive, right side tragus is very sensitive to touch. Now third is bladder. If bladder causing problem after lumbar surgery, cesarean, forceps delivery, like there is complaints like dysuria, retention in the females, the causticum is only remedy which will cure in the very small dose. It work beautifully in this case where the females suffer from dysuria or retention of urine after the surgery of any lumbar surgery or forceps deliveries. Unique concomitant is yawning with GI complaint. Appendicitis, diarrhea, flatulent choling means any of the abdominal complaint there is concomitant yawning which is seen in the causticum patient. Restless leg syndrome called as dancing leg during sleep. This is very important and there are no such medicine in the allopathic system, but in homeopathy we have causticum for the restless leg at night. It works wonderfully in this case. The next is eruption in the side and outside of the nasal ring, inside and outside of nasal ring. Third is stammering when stressed, nervous or excited. The patient, it means patient starts stammering during patient is nervous or if he is fighting with someone or if he is excited or when he is in stress. Otherwise the patient is not stammering. Next is warts on the tip of the finger and close to the nail and the margin of the eyelids, the special site of warts in the causticum patient. This is found in causticum patient very frequently. Now it is very important remedy for carpal tunnel syndrome and dupuytren's contracture. It works very wonderfully in this carpal tunnel syndrome where tendon is very contracted, which causes problem. And in contracture, dupuytren's contracture, where fourth and fifth finger is getting contracted, it works very wonderfully in these cases. Causticum is very much useful in this case. Now we will see Kent's repertory rubric. It is very beautifully explained in the Kent's repertory. First is extremities, contraction, fingers, flexor. Causticum is one of the remedy. Other are arsenic, semesic and silicia. Second is extremities, contraction, wrist, shortening of the tendon. First remedy is causticum and second is carbobage. This is the beauty of the repertory, that we see extremities, contracture, shortening of the tendon. This is carpal tunnel syndrome and one of the remedy is causticum. Okay, now next in the skin we will see warts which are bleeding. Causticum and other remedies are also there. Warts which are flat, which are fleshy, which are horny, jagged, old, painful, pedunculated, small, pustulating. In all this we will see causticum, and there are also other remedies, but causticum is one of the remedy of these kind of warts. This is all about causticum. If you like this video, please do like, share and subscribe. Jai Hind, Jai Bharat.